Hello there, my name is Dr. Karl Fernandes, and today I'd like to talk about a topic called obstructive sleep apnea or sleep apnea. It's a disease that affects about 4% of the population, male and female, although it's common in more males, and in fact 4 times more common in males until women lead menopause. What happens, unfortunately, as we get older, our muscles all sag, and that includes our upper airway muscles, our tongue, our palate, and our base of our tongue. So people who have obstructive sleep apnea basically lose their muscle tone when they're sleeping. That means that even though they're making an effort to breathe in and out, their upper airway collapses in the back of their throat, either completely or partially. When that happens, not enough oxygen is getting into the lung, and then sometimes they snore very heavily, sometimes they have very restless sleep, and when they wake up in the morning, they don't feel refreshed. They feel tired, they feel irritable, but there are also physiological effects. As you can imagine, if you're not getting enough oxygen to your heart, that's not a good thing. Over time, that can lead to high blood pressure, stroke, and even heart disease. The main form of treatment for sleep apnea is something called CPAP therapy. CPAP stands for continuous positive airway pressure. So if you can imagine that the problem is your airway is obstructing, then by giving the pressure to your airway in the form of a mask that's attached to a machine, it keeps the airway open. It's effective in about 98% of the time. So it's best to go ahead, and if you have symptoms, or if your spouse or significant other is telling you that you have symptoms, you should see your doctor and get treated.